Motion sickness is a common disturbance some people experience when they are traveling. It can happen in a car, on a boat, on a train, or even on an airplane. You might also hear it called car sickness, seasickness, or air sickness. These are all the same condition, just named for where they happen. This feeling usually starts quite suddenly. One moment you might feel perfectly fine, and the next, a wave of discomfort can wash over you. The good news is that for most people, the symptoms tend to fade away once the motion stops, bringing relief. Understanding this condition is the first step towards managing it effectively and making travel more comfortable. The symptoms of motion sickness can vary from person to person, but there are several common signs to watch out for. Many individuals first notice a general sense of unease or malaise. This can quickly progress to include cold sweats, where your skin feels clammy and cool. Dizziness is another frequent complaint, making you feel unsteady or as if the world is spinning around you. Some people experience a headache or increased irritability. Nausea is perhaps the most well-known symptom, often leading to vomiting if the motion continues or is particularly intense. Other signs include pale skin, fatigue, difficulty concentrating, and sometimes an increase in saliva or rapid breathing. The primary reason motion sickness occurs is due to a conflict in the sensory information your brain receives. Your brain gets signals from different parts of your body about whether you are moving or stationary. Your eyes might see the interior of a car or cabin, suggesting you are still. However, your inner ear, which helps with balance, senses the motion of the vehicle. Your muscles and joints also send signals about movement or lack thereof. When these messages don't match up, your brain becomes confused. This sensory mismatch, this internal disagreement, is what triggers the unpleasant symptoms of motion sickness. For instance, reading a book in a moving car often causes this problem. Fortunately, there are several effective strategies you can use to prevent motion sickness or lessen its impact. Choosing your seat wisely can make a big difference. Try to sit where you will feel the least motion. In a car, the front passenger seat is often best. On a ship, a cabin near the middle and close to the water level experiences less movement. On an airplane, a seat over the wing is generally more stable. Ensure there is good air circulation, perhaps by opening a window or using an air vent. Try to focus your gaze on the horizon or a distant stationary object. Avoid reading or looking at screens. Keeping your head still, perhaps by leaning it against a seat back, can also be very helpful. When prevention strategies are not enough, or if you anticipate a particularly challenging journey, conventional medications can offer relief from motion sickness. These treatments are generally effective for many people, though they can sometimes come with side effects. It's always a good idea to discuss these options with your doctor or pharmacist, especially if you have other health conditions or are taking other medications. They can help you choose the most appropriate remedy for your specific situation and advise you on the correct dosage and timing. Understanding how these medications work can empower you to make informed decisions about your travel health and comfort. One common category of medication used for motion sickness is antihistamines. Interestingly, it's usually the older antihistamines, the ones that tend to cause drowsiness, that are most effective for this purpose. Medications like meclizine, often sold as Bonine or Antivert or dimenhydrinate, the active ingredient in Dramamine original formula, are popular choices. These are typically taken about 30 to 60 minutes before you begin your journey to allow them time to start working. For children over the age of 2, these can often be safe options, but always check packaging for age-specific dosing. Promethazine is another antihistamine, available by prescription, which is also effective but can cause significant drowsiness. Another widely used conventional treatment is the scopolamine patch, often known by the brand name Transderm Scop. This is a small, adhesive patch that you apply to the skin behind your ear a few hours before you expect to encounter motion. Once applied, the patch slowly releases medication over a period of up to 72 hours, providing long-lasting protection. This can be particularly convenient for longer journeys, such as cruises. However, scopolamine is generally recommended for adults only. A common side effect is dry mouth, and individuals with certain conditions like glaucoma or urinary retention should consult their doctor before using it, as it may not be suitable for them. Beyond these, there are other options available. For example, some non-drowsy formulas of Dramamine contain ginger as their active ingredient, which is a more natural approach but still offered in a conventional medication format. It's important to remember that even over-the-counter medications can have side effects or interact with other drugs. Always read the label carefully and follow the recommended dosage. Taking medication 1 to 2 hours before travel is a general guideline, but specific instructions may vary. Consulting with a healthcare professional ensures you are using these treatments safely and effectively, helping you to travel with greater ease and less discomfort. For those who prefer to avoid conventional medications, or are looking for complementary options, there are many natural remedies that can help manage motion sickness. These approaches often focus on restoring balance within the body or using natural substances to calm the systems affected by motion. Many people find these methods to be gentle yet effective, with fewer side effects than some pharmaceutical drugs. Exploring these natural avenues can provide you with a toolkit of strategies to make travel more pleasant. Remember that what works well for one person might differ for another, so a little experimentation might be needed to find your best fit. Acupressure is a traditional technique that has gained popularity for alleviating nausea, including that caused by motion sickness. This method involves applying pressure to specific points on the body. The Niquan or P6 point, located on the inner forearm about 3 finger widths down from the wrist crease between the 2 tendons, is particularly well known for its anti-nausea effects. You can apply firm pressure to this point for a few minutes when you start to feel queasy. Commercially available acupressure wristbands, often called C-bands or relief bands, are designed to continually stimulate this point and are a convenient option for many travelers, including children and pregnant women. Some people also find relief through acupuncture treatments. Aromatherapy, using the scents of pure essential oils, can also be a helpful tool. Certain aromas are known for their ability to soothe the stomach and calm the mind. Ginger essential oil is a classic choice for nausea and digestive upset. Lavender oil is known for its calming properties, which can be beneficial if anxiety contributes to your motion sickness. Peppermint oil is another popular option, often used in hospital settings to help patients with nausea. You can use these oils by placing a few drops on a handkerchief to inhale, using a portable diffuser for short periods, or even wearing an essential oil necklace. Always ensure you are using high-quality pure essential oils and use them sparingly. Herbal remedies offer further natural support. Chamomile tea is well regarded for its ability to soothe the stomach, reduce acidity, and relax the muscles of the digestive tract. Sipping on chamomile tea, either hot or cold, before and during travel, can be comforting. Licorice root, often available as lozenges, is another traditional remedy used to ease stomach discomfort and improve digestion, potentially preventing motion sickness symptoms. Additionally, some find that vitamin B6 or pyridoxine supplements, often used for nausea in pregnancy, may help alleviate motion sickness. It's important to stick to recommended dosages for any supplement, as even natural substances can have effects if taken in excess. Homeopathy offers a unique and individualized approach to treating motion sickness. This system of medicine is based on the principle of like cures, where a substance that causes symptoms in a healthy person can be used in a very diluted form to treat similar symptoms in an ill person. For motion sickness, a homeopathic practitioner will consider your specific set of symptoms, not just the nausea, but also how you feel emotionally, what makes your symptoms better or worse, and any accompanying sensations. This personalized assessment helps in selecting the most appropriate remedy from a wide range of options available, aiming to gently stimulate the body's own healing responses. There are several homeopathic remedies commonly indicated for motion sickness, each suiting a slightly different symptom picture. For example, Cocculus indicus is often recommended when there's a feeling of emptiness in the abdomen, and nausea with dizziness that worsens with the slightest movement, perhaps even leading to faintness. This remedy is particularly noted for sickness from cars, boats, or trains. Tabacum nicotiana is another key remedy, often used for severe, persistent nausea that can lead to vomiting, accompanied by an episodic dizziness that might cause fainting, and a characteristic sinking sensation in the upper abdomen. Understanding these subtle differences is key to homeopathic prescribing. Other homeopathic medicines can also be very effective. Petroleum is considered when there is severe discomfort, nausea, and vomiting while traveling, often with an empty or weak feeling in the stomach and sudden nausea in cars that might even cause breathlessness. Sepia succus might be chosen if motion sickness is accompanied by anxiety, with nausea and vomiting specifically when traveling by car, and a feeling of tenderness or emptiness in the lower abdomen. Ipecacuanha is indicated when there is a persistent nausea, not necessarily relieved by vomiting, often aggravated by slight movement and a general feeling of the stomach emptying. a homeopath can guide you to the best choice. While many instances of motion sickness can be managed effectively with self-care strategies or over-the-counter options, there are times when it is advisable to consult a healthcare provider. If you experience chronic and persistent nausea or vomiting even when not traveling, it's important to get checked. Similarly, if symptoms of motion sickness occur without any actual motion, this could indicate an underlying issue that needs medical attention. A key concern with severe or prolonged vomiting is dehydration. So if you notice signs like extreme thirst, dry mouth, dark urine, or dizziness upon standing, seek professional help promptly. Your doctor can help rule out other conditions and ensure you receive appropriate care.